you for calling and for the invitation to be on such an exciting event. I've never been on such an event, so this is really my first time, but I believe it will be something that we will repeat maybe in future. Endocrinology is, we are feeling that there is a renaissance of something within the endocrinology, which is actually the impact of the endocrine oncology on the first place, because this is a new field that it is very, very well known in medicine at large. But endocrinology is really very fastly entering into this field. And so we are facing with lots of challenges. And one of those is actually the lifestyle, how to adapt the patient toward the new situation. So this is a challenge for the doctors, but also to the patients, to both categories. But what is more interesting is the story about the widely known epidemiological diseases, or we can say the non-communicable diseases like the diabetes type 2 or obesity. So with those two conditions, but mainly with obesity nowadays, we are really facing with lots of challenging issues in how to organize the mind, I can say, of that patient to go and to follow what is needed for the health at the first place, but also for the well-being of that patient, of that patient in that condition. Because this is really a very mosaic type of the disease, because if we want to treat properly, then we have to arrange not only the endocrinologist, which is I can say, the conductor of the orchestra, because you have to monitor and to maintain the metabolic outcomes. Actually, you have first to adapt the patient toward the new therapies, to somehow to approach to the patient with the strategies, what should be expected from him, what do we have as our tools, and then to expect the outcome. So this is a long way, and that's why we have to be prepared to have a lot of nerves, I can say, for the patient. But first of all, patient must realize that nothing is so quickly and nothing could be changed immediately. So the communication with the patients are absolutely the hallmark or of the paramount importance for the positive therapeutic outcomes. And this is the type of the diseases that should be delivered to the patient treatment program as a team. So we are very frequently talking about the MDTs, like the multidisciplinary teams. This is the phrase that I used mainly for the oncology patients. But now, on the other side, we have those really very much presented diseases in the whole population that needs the psychological support, I can say. So we are coming probably to the point of your day, which is the support of the patient. And we are desperately trying to find somehow, and sometimes persons that will be enough motivated to be the member in the team of the on the long way toward the outcome of the patient, which will be the reduction of the weight, then to maintain glucose control, which will be nice, etc. We are talking about the population. If we are talking about the type 2 diabetes, we are talking about a population of around 10% per population. So in Serbia, we can say that we have around 700,000 patients with type 2 diabetes. But within the etiology of the diabetes is obesity. That means that we have at least a double number of the patients that has the potential to develop diabetes. So these are the pre-diabetic conditions, and the obesity is one of those. Then we are talking about 20% of the population with some problems with nutrition, overweight, etc. If you consider that, okay, let's say that this is the exaggerated number. We can talk about a few 100,000 persons definitely that need support. This is a huge, the huge need for the building of the motivation capacity of the patient to accept the therapy, to accept the advices, because nothing could be nothing could be treated or fixed by taking only a single pill or the injection of a drug. If you do not prepare the patient, you will not have the good outcome. Or if you are treating them with the very popular therapies nowadays, which are used for the obesity treatment, you will have good response, but that will last only for the period of the treatment of the patient. That means a few months, maybe a year or two, but after that the patient will cease, and then he will jump on to the previous level of body weight. So we have to prepare the patient with some type of the, I can say, psychological support. And this is something that I'm always stressing with my colleagues on psychiatry, that we must build teams, that we must include the clinical psychologists on the first place, but also the patients that are trained to be of support. And in my mind, I think that in the next future, in about 5 to 10 years, probably we will have lots of units, single organizational units, to be of support to those patients, because this is almost impossible to maintain such a number of patients coming every day to, or for the nutritional devices, for something else. So I believe that you will be our first collaborators in future, and that's why I think it's really important to develop programs for education in obesity, for instance, but not for the professionals. This is for the patients, I can say. So this is the current situation in the field of endocrinology that is really very rapidly growing, and we are getting lots of new patients because we are the field of metabolic derangements that are actually everyday situation within almost everyone in the world. If we are talking about the official healthcare providers or the system in Serbia, we have preventive centers. We used to have preventive centers in every health community unit. So these are Dom Zdravlja in Serbia. And we used to have those preventive centers that were created as the sites within those healthcare centers, primary healthcare centers, to provide all the support. But this strategy failed in some meaning, so we do not have such approachable units within those healthcare centers, because the doctors are not dedicated, or they are not positioned to be always there. So they are changing their working positions and they're going around. So we do not have dedicated doctors for that. That's why I think that somehow that should be outsourced in future. And we really have to think about preventing or preparation centers somewhere outside the official healthcare system, because the need for that is really very wide, and we need lots of support of that. That's why I believe that the task or the role of the lifestyle intervention or coaching will be of extreme importance, at least in those non-communicable diseases. So these are all the diseases that are not infectious diseases. If we took the COVID-19 on the side as the past history or the history of us, then we will have a large number of patients that are actually non-infectious, and metabolic issues are the perfect model for that. I believe that in the other parts of medicine, you will find the same type of examples, but I believe that we will need really some preventional or preparation lifestyle programs that will include nutritional advices on one side, and on the other side, increase of the physical activity. Someone has to coordinate that. This is not only the task for endocrinologists, because we have to deal with the metabolic outcomes, the levels of treatment, to decision of how to treat the patient, to monitor the whole program. So that's why we need another type of specialty advice persons or coordinators that will take care about the altitude of the patients and the outcomes in that meaning of how much time do they spend with the, for instance, physical activity, and do they really follow your advices? So this is something that must be like the really supportive therapy or psychological support. I always stress this with my patients and always sending them to some professionals which are very hard to find, believe me, because I mean, on a part of the psychiatrists that are really few that would like to go in that, because everyone wants to just to give a pill and to finish everything. So we are not talking about the pills. My patients are not always in the need of psychiatrists. So that's why lifestyle coaching or lifestyle coordination, let's say, this is more soft for me, because if you say coaching, that means that you have to give yourself to someone and to control your at the level of 100%, which is not acceptable and this is not ethical. So let's say the coordination. So lifestyle coordination should be more proper phrase, I believe, for the development of something that will be more and more needed. If we are, if we are in a position of a patient or a consumer of the lifestyle intervention, let's say, so it could be possibly useful to have those apps, or maybe to organize a platform for easier approach toward the questions, etc. Well, on one side, this is very useful. On the other side, you must have a whole machinery who will answer on those issues. So you must take in your mind to have a whole setup. So this is probably good option to bypass all the misinterpretations coming from the internet, misuse of drugs, of strategies, etc., for the patients that are reading everything on the internet and then applying that in everyday life. So this is better on that side, but it is almost impossible to have the situation to have so much assistance in that process. So I believe that maybe selection of some categories to have some consumers that will be a good point for that. For instance, youngsters or the young people that are, for instance, obese or that need nutritional advices, they will be much more prone to use those advices. I mean, to use the computer science for the correction or adaptation of something. Maybe there are some other categories that are very much interested for their health. For instance, pregnant women. They are probably one of the good examples that are taking care about themselves extremely good during the period of pregnancy. So we have to point on that, or to use that momentum for the development of something new. But we have a huge number of persons of the population which are the mid-age or older age persons that will be actually not very, very good for that model. But if you select few, groups, then you will probably have lots of consumers, and then maybe such programs could be useful, especially for those younger, I believe, than 50 years. So in different conditions, in different needs, you have to select, or maybe to develop a program which will be selectively used. You can scroll and, for instance, find the specific type of alive, like the directly communicating with someone to get immediate response. I'm optimist, but not always by definition. So I think you must be always cautious, and then you must always be, you have to ask yourself, are you working the right thing? So I will be rather cautious, but what is coming to my mind is to provide something to the primary health care. This is something that could be done through the NGO approach. So if you are an NGO-based organization or could be connected to those NGOs, you could do tremendous work at the level of the primary healthcare providers in Serbia, offering them support. And that could be something completely new that is not so costly, that will be probably done through some, I don't know, granting system. And then you will provide specialists, because we have very sudden situations of the horrible attacks within the schools, and now we have a huge move of psychologists. I have patients of my patients that are going to this elementary school in Belgrade, to Ladislav Ribnikar, and providing their voluntarily support. So people, I think, are ready to help and to be involved in some types of structured support. And I believe that you could start from those very basic but very important fundamental health care providing systems in the public sector. I'm not sure about the private sector, because private sector is always by paying. So I don't believe that those big health systems will be very happy to have something on free. So your modeling will be much more better, and I believe much more, how can I say, as the good sign of your attitude to help, to be given to some some communities, maybe as a pilot study, to provide them or to offer them help. In big, for instance, in big population centers, like big towns like Belgrade, Novi Sad, Niš, huge centers concentrated people with the loss of specialists. So your program of life coaching, in some segments, when you make first the analysis of first you have probably to select the issues, but from my point, those epidemiological large cohorts of patients will be an excellent program for you, or maybe the pilot study, at least in some centers in Vojvodina and in Belgrade, I believe. Thank you very much, Jelena. I wish you very, very good work in those 2 days. And I say hello to all your friends and colleagues. And I'm really very sorry not to be alive with you, but I believe that next time I will have less concentrated schedule with me. Thank you very much, and all the best.
You too. Bye-bye, Djuro.
Bye.